I read about your background, so that's where I started. I said, Skid Row is where I think of when I think of people that might have come from really dysfunctional backgrounds. Maybe there's addiction, mental health issues, homelessness, and this all is part of King Iso's story.
Yeah,
So when
yeah,
I saw your name and
yeah,
your background, I'm like, this is the guy. This is the
yeah,
guy.
yeah, yeah, yeah. Well, thank you. And I'd also add, in addition to that, I've got a background as a geneticist, a psychiatric geneticist for serious mental illness, so I can speak to that. And I'm also for the past 3 to 4 years, well, but before that, working at the VA, running our SMI programs there, and then the last 3 to 4 years, kind of chief medical officer of Amae Health, AMAE Health, and we are very focused on building intensive outpatient clinics for folks with thought disorders or really just any serious mental illness usually coming straight out of the inpatient, or at least a lot of our folks are coming straight out of inpatient. And really, right now, there are very few places that provide that intensive care. So I add that because, at Amae, we are building models clinical models, clinical care to really address kind of the full whole person care for folks with serious mental illness. So,
Yeah, and
yeah,
I'm going to ask questions about that because even in your bio, I must have gotten 10 questions, because I'm so
yeah,
interested and so curious about what you're doing. I've been a music journalist for 30 years. Um, I didn't like seeing all the musicians that were dying from
mhm,
suicides. So I decided to do something. I was also in healthcare for like 30
mm,
years. So
yeah,
I know about medications, psychiatric medications I used to promote. I was with Merck and AstraZeneca
mm,
and Bristol
okay,
Myers Squibb. But um, the, anyways, the mission with the Check Your Head podcast really is to improve lives and to save lives. And so we're providing solutions because I believe that everybody should have the ability to, well, should it should be accessible to everybody. So on my
yeah,
website, I have hundreds of free and
yes, I
affordable.
saw that.
So
Yeah,
yeah, so that's really our
yeah,
mission, and I thank you for being part of
yeah.
that.
Well, likewise, yeah. No, we are like-minded and on the same team, so to speak. Yeah, it's great what you do. It really is. Yeah.
Well, thank you, and so anyways, I just wanted to see if you had any questions before we start. Anything that you need to say?
No, no, yeah. I listened to your interview with King Iso. I really enjoyed. He is a lot of wisdom in
A
what he has to
lot of
say. So
wisdom.
yeah, yeah, yeah. It was a great interview.
Well, the funny thing about it was that when we recorded it in the studio, I had read up on his story, listened to the lyrics of his album because he writes all
Yeah.
about his journey.
Yep.
And, you don't know what to expect. But what I found was this sweet, shy, gentle man
Hmm.
that you wouldn't expect would have these, everything that he
Yeah.
went through,
Right.
addictions,
Yeah.
um,
Trauma. Lots of trauma. Yeah.
homelessness,
Yeah.
so much trauma. And
Yeah.
it was almost like all the cards were stacked against him,
Absolutely.
actually
Yeah.
just coming out into life.
Yeah.
Um, I mean, just in general, from listening to that interview, what are your thoughts on his story?
Yeah. No, I think, I mean, you pointed out a lot of the very, very salient points, which is, it comes from, heavy background of trauma, right? I mean, just both trauma, but also, a family that, I mean, he mentioned numerous family members that have had been diagnosed with some sort of serious mental illness. So, and mentioned himself the heritable component, so I think he really represents one kind of someone who does have genetic kind of predisposition towards some sort of serious mental illness and at the same time grew up in an environment that was very traumatic, right? And, even pointing to, I mean, he hinted at a lot of the trauma that I'm sure that, the backstory behind that is pretty elaborate. But the things he did point out, including, the loss of this close friend of his in teenage years, that you kind of look at that as a huge trauma on top of a lot of kind of small to medium and other large traumas that really seem to kind of, maybe not a great metaphor, but kind of the straw that broke the camel's back, right? Really tipped him over into a pretty distressed state. And
Right.
then he did talk a lot about the specifics of the substances, but clearly, the substances were involved, which is a very common thing, right? And when someone is in a high degree of distress, it is pretty common to go to substances. And then once you're using substances, that in itself, the substance use, lower your kind of judgment and insight, making it, that much easier to keep using substances. Or the other way to say it is it makes it that much harder to kind of get off of the substances. Um, and so, I think there was, his story really provides that, that whole, we don't really think of nature and nurture anymore. We really think of there's a combined, genes and environment, and the combination of which really puts you at risk. And in him, you really see all of those elements coming together.
I noticed all my squishmallows here in the background. That
Yeah.
was a really great, a great impression for
Oh, look
everyone.
at that.
Well, um, I agree with you. I feel like, I mean, it's funny because when he told me his story and I looked back on my notes, I forgot about all the stuff that he had gone through. He talked about sexual molestation,
Right,
which, you know, kind of started this big spiral on top of the
right,
fact that he had family history of schizoaffective disorder, bipolar. He mentioned bipolar 2 for himself as a diagnosis and schizoaffective as a diagnosis. And, you know, the loss and the rape of his friend. There's so much going on, but it opened up my eyes to what it's like possibly to grow up in so much dysfunction, in a neighborhood that
right,
had dysfunction, in a family that had dysfunction, and not knowing the tools, the healthy
right,
tools to solve your problems. So
right.
he ends up doing jail time. Um, when you come across a patient like King ISO with maybe a similar background, I mean, where do you start at that point to
Right.
try to develop a treatment plan?
Yeah. Yeah, that's a great question. Some of the first things that have to be addressed are really the social determinants of healthcare, right? Which for him, when he was homeless, it's really hard to do any sort of mental health care when you're homeless, right? I mean, life is essentially about survival at that point. And, finding, a warm, dry place to stay, staying safe. The streets are incredibly dangerous. There's a lot of violence out on the streets. Certainly can be community. But again, that community tends not to be the most supportive, although I want to be careful because there can be homeless communities can be, very, strong communities to an extent. But there's also communities that, have a lot of drug use and violence. And so in that sort of environment, in that sort of setting, it's very, very difficult to do any sort of deep mental health care or even physical health care. So through Homeless Healthcare Los Angeles, for folks that are homeless, we're working, to get them showers and laundry and clothes and shelter. We also do a fair amount of harm reduction, right, to make sure that they, if they're using needles, for example, that they have access to clean needles, that sort of thing. But that's the sort of work that we're really focused on when someone's homeless, and the need to get them into housing and casework, right? A lot of times folks that are, living on the streets or homeless, they really don't have their insurance in place. So they, even if they end up in a hospital, a lot of times the lack of insurance really limits the amount of care they can get or the places they can go. So to start, if someone who's homeless and has a lot of mental health issues really need to address that homelessness, really need to get them in a place that's stable, they know where they're sleeping at night. Um, and then the next thing that's really important even before treatment, a lot of times is community, right? They need folks that they can connect with. Um, ISO talked a lot about the support he has through friends and close friends. They check on him. They kind of call him out when, if he's been, absent for a little bit or not communicating for a little bit. So I think the community becomes a very important, element that needs to be in place. And then once those things get in place, then someone can really start to do more mental health treatment. And that can include, medications, therapy, kind of these traditional set of treatments. But again, I think when someone really doesn't have the basics, just a community and housing, really need to be able to address those and get something in place. Otherwise, it's very hard to do, any sort of ongoing treatment.
Well, that was one thing that I really loved about homeless healthcare is that not only do you do things like clean needle exchange, which is a practical thing, right? Because a lot of
Right.
people that are homeless could have addictions, and the last thing you want is spread of disease through
Right.
HIV or other, diseases.
Right.
And sometimes people don't understand that, right? Sometimes people might think,
Correct.
"Oh, are you encouraging drug use?" No, you're
Correct.
doing
Yeah.
something that is practical until you could get them the care that they need.
That's right.
But you also
That's
give,
right. I,
yeah,
I, I always say no one starts heroin because they have access to a clean needle. That just is not how the world works. The folks, if when we hand out, sterile needles, it's to folks that have been doing intravenous drugs for years and years. And it's exactly what you say. We're mitigating additional harm to their health, right? It's trying to keep them alive. And part of, when we hand out needles, we're also handing out resources for care. We're doing things like basic health care, abscess care. It's a really an opportunity to engage people. And in a way that they really appreciate and understand that there's a lot of respect and we're really working to respect their dignity and just say, here, we know this is something that's important for you and we want to provide that, and here's these other resources, so whenever you're ready we can start connecting you to these resources that ultimately lead towards the path of stability.
yeah. The other thing that I learned through homeless healthcare is that homelessness is often, you could correct me if I'm not quite right, but a lot of homelessness has to do with mental health, mental illness,
Right.
addiction, teenage runaways that might be abused, or people that are being abused domestically, um, and not so much people that just don't want to work. I mean, I think there's also that societal maybe not understanding why the majority of people are homeless. I mean, is that pretty much
Yeah,
true?
you're correct. I mean, homelessness is a very complicated situation. And as you mentioned, I'm here in Los Angeles where, I mean, it's kind of the epicenter for homelessness in the country. I mean, homelessness is bad in a lot of cities and urban areas. I think Los Angeles represents a particularly, troublesome situation. And you're right. I mean, it's very, very multifactorial. There are, for example, in Los Angeles, there are families, especially immigrants, who are out of work and just don't have the resources. They're homeless. There can be kids involved.
Mm.
Those folks, a lot of times, they can be mentally quite healthy, physically quite able-bodied, but again, maybe they're undocumented immigrants and have a limited access to work and resources. Those folks, a lot of times, are homeless for a briefer period of time, maybe 2 to 3 months, while
Mhm.
they get back on their feet. They are able bodied, they are mentally healthy, and they are able to kind of eventually plug in. But folks that do have a lot of mental health struggles, um, and again throw addiction and substances on top of a mental health problem that's there from the beginning, and it's just kind of the perfect storm of taking away a lot of folks' ability to really care for themselves. And you're correct about these are not lazy folks that just don't want to work. I have worked with many, many homeless folks. That's a thought that never crosses my mind. if I mean, the reality is, if you're lazy, you don't want to be homeless. Homelessness is an incredible amount of work. It is much harder to be homeless than work a 9 to 5 job. Homelessness is, folks have trouble finding a place to sleep. A lot of folks, they'll tell you they use substances, especially something like methamphetamine, so that they can stay awake and stay safe all night because they're afraid to go to sleep because it is so dangerous on the streets. So again, I think that really points to the fact that being on the streets, being homeless, is not easy. There's no way you could really work with homeless people and call them lazy. That's not the case.
Right.
And further, in general, all people have a wish to live a meaningful, purposeful life. And homeless folks are included in that group, so they really do have a sense of loss and are looking for meaning and purpose.
Well, thank you for explaining that. I think it's important to note because, it's of course better to work with facts and statistics from somebody that works directly with these patients in this population, opposed to having these myths that sometimes keeps going on when there's really no basis in that fact or that
Right.
myth, actually.
Right.
Um,
Correct.
so once you get them to safety, um, you're with somebody that has mental illness and addiction, what's the next step in the process toward
Yeah.
treatment?
Yeah. At that point, so it's a great question, and it really is individual to individual. There are kind of two general approaches when someone has addiction and mental health, kind of more primary mental health issues, something like psychosis or thought disorder or severe depression. And the idea is you have to be working both the addiction as well as the primary mental health issue simultaneously, although sometimes you really need to focus on the addiction. In fact, I would say often the addiction has to come under enough control that you're able to make progress for the primary underlying mental illness. Um, when someone's in the full throes of substance use and addiction, it's very hard to do treatment. The medications, frankly, are going to have limited usefulness because the substances are often, one way to think about it is they're much more powerful than psychiatric medications. And so when someone is, drinking a lot or using methamphetamine or cocaine, the psychiatric medications are going to be of limited benefit. So again, a lot of times the addiction has to take front and center focus to get it under enough control that you can then start to work on the other things.